back, friends. Now we'll discuss about the application of monoclonal antibodies. This monoclonal antibody have a wide range of application in the field of diagnostics, imaging, therapeutic reagents in clinical medicines. Many monoclonal antibodies diagnostic reagents now available are products of detecting pregnancy, diagnosing numerous pathogenic microorganisms, measuring blood levels of various drugs, detecting antigens shed by certain tumors. So, here I could say that it is either used as diagnostic or imaging therapeutic agents, and nowadays the commercially what it meant is that commercially we are having so much detecting kit, like for the pregnancy kit we are having, like for the detecting of some pathogenic microorganism. Even we can even detect the level of some drugs, or even the sugar detection can be done using MABs. Even presence of tumor can be detected using monoclonal antibodies. For example, if I explain pregnancy kit, we could see that a pregnant woman used to release the hormone human chorionic gonadotropin in her urine, and we will synthesize a monoclonal antibody. We'll consider that a HCG as an antigen, and we'll synthesize a monoclonal antibody towards a HCG. And we what we do is we will uh, combine it with a enzyme too, and that is being introduced in the pregnancy testing kit. And what we do is that what we can see is that if a person's urine is added into that kit, and it as it is being run, when it come this urine, if it is having this enzyme human core HCG, that will, of course, within no minute that will be that will interact with the monoclonal antibody of HCG in the immobilized condition in a single line. And as we know that this monoclonal antibody of HCG is being connected with a dye too. What the dye do is dye will be changing its color. It becomes colored, and that shows that the person is having the urine in which HCG is present. And this HCG is present only in pregnant ladies. So that is a principle used for detecting pregnancy. Next, we can see this is also used to detect, as I said, of some infectious organism, like for example, the test of HIV. And here, what we do is we will be synthesizing a monoclonal antibody against the HIV antibody, and we are looking for HIV antibodies. So here we could see what we do is the HIV antigen is attached to the plate. The patient's serum will be passed on this plate, and we know that when the patient is having an virus, that person's blood will be having the antibody too. So that antibody will bind to this monoclonal antigen or the antibody what we have done. Again, a second antibody will be added against passed over the plate, and this antibody will be attached to a enzyme. And we can see that this second antibody with an enzyme will also be clubbed with a chromatin dye. It will be passed on over the complex, and what we can see is that if a person's blood is having a HIV antibody, that will with no doubt will bind with the antibody present on the plate. Here you could see this is the antibody or the HIV antigen, and when a person's blood is having the HIV antibody, when it is been smeared, it will become a cross-link, that is antigen antibody complex. Now I'm adding another antibody, which is antibody, that is the antibody against the antibody, and within no time that will specifically bind to the antibody. And the specificity of the second antibody is that they are being clubbed with an enzyme. Now what I do is I'll add a chromatin, a dye, and this enzyme have the capacity, if the enzyme is present, they will that means only and if the enzyme is present, the color will change. And if the enzyme is present, that shows that it is being bounded to the plate. Otherwise, if the patient's blood does not have the HIV antibody, there will be no this red color thing. And if this red color thing is not being here, immobilized condition, this green color thing, even if I add, it cannot have any binding. That means after that it will be uh, washed off. That means there is no green color and this red color antibodies if a patient is HIV negative. And even if I add this chromatogen or this dye, since there is the absence of enzyme, that will not change color. But then it is in the opposite condition. If the patient is HIV positive, it may be having this antibody, and if I add an antibody with an enzyme, it will bind with it. And then if I add a chromatogen, that will change the color into another color. And the intensity of the color change shows that much of HIV antibodies are being present. Now, treatment of next application of this monoclonal. One is diagnosis that we have just seen. One is detection, diagnosis. Next, we can see about the treatment. Here, this antibodies can also be used for treating cancers. That is, cancer cells normally we know that they are having some specific antigen, and I can call it as tumor associated antigen. And these antigens may be present on the plasma membrane. Now, what we do is we will be synthesizing a monoclonal anti tumor associated antigen antibodies. And what we do is we know that if I add a monoclonal antibody for this TAA, that will specifically bind to this TAA. But what if I add a drug linked to this monoclonal antibody of TAA? So what happens is that if I'm having cancer, I may be having the TAA, that is tumor associated antigen, or the epitope on my uh, cancer cell. What then if I introduce this antibody towards this TAA with a drug, anti-cancerous drug linked to it, that will take my drug specifically to this cancerous or tumor cell without causing any damage to the neighboring cell. So that becomes target specific. So that's all. Thank you.